Hi, I'd like to chat today about how to move in bed when you're pregnant, especially if you're experiencing any pelvic girdle pain. So we're going to start off with just sitting on the side of the bed, and then we're going to go from there. So instead of doing any half sit-ups or half sit-backs when you're getting into bed, what I'd like you to do is just start by sitting on the side of the bed, and then you're going to pretend that you're a mermaid. So this means laying down on your side and bringing your legs up at the same time. So your legs don't have to stay together, but I would like them to move together. So you're laying down on your side, and then to move over onto your back, you're going to use your glutes and your feet to push into the bed and roll over all in one block, sort of like a Lego person. And then once you're on your back, if you want to roll over to the wall, you're going to straighten one leg and then push with your glutes and the foot that's still bent to roll over onto the side. And then to roll back over onto your back, you'll put your feet into the bed, squeeze your glutes and roll over onto your back. And then roll to the opposite side. You'll straighten this leg and push over again. And then finally, to get up out of bed, you'll push in with your elbow and your hand to push yourself back up. So sometimes this takes a little bit of practice to get used to, but it can be helpful, especially towards the third trimester when it's a bit more tricky to move around.